Hi everyone, it's Leslie here. Today we'll be discussing septic shock. Septic shock is a life-threatening condition. It's caused by a widespread infection. Normally it's gram-negative. This leads to very low blood pressure and organ dysfunction. Some common infections include pneumonia, UTI, blood infections, and abdominal infections. Some expected findings include a fast heart rate, low blood pressure, fever, shaking or chills, warm or clammy skin, confusion, shortness of breath, sepsis rash, extreme pain, or discomfort. Some risk factors include advanced age, immunocompromised, indwelling catheters, and hospitalizations. Some lab tests include ABGs, blood lactic acid levels, glucose, electrolytes, PT, INR, and APTT. You can do some CBCs too. Diagnostic procedures include ECG, arterial line insertion, chest x-ray, CT, or ultrasound. A safety consideration is to always have resuscitation equipment at bedside because you never know when you're going to need it. And some nursing care include monitoring oxygen, monitoring the vitals, monitoring urinary output, and level of consciousness. Medications include fluids. People with septic shock, fluids in large amounts can be normal saline or lactated ringers, vasopressors, antibiotics, oxygen therapy, blood sugar control. They can be put on hydrocortisone too for inflammation. Therapeutic procedures can include surgery, needle decompression, and chest tubes for respiratory distress or lung failure. Client education includes completing the entire antibiotics, even if symptoms subside. You're most likely going to have the respiratory therapist coming to help you out. Some complications include multiple organ dysfunction syndrome and death. Overall goals as a nurse is to look for evidence of adequate tissue perfusion, restored blood pressure, and recovery of organ function. You're going to provide emotional support to the patient and family. To summarize, septic shock is life-threatening and it's caused by a widespread infection. Early identification and treatment will definitely help. Patients who have septic shock need lots of fluid replacement to get the blood pressure up. The three major pathological effects are vasodilation, maldistribution of blood flow, and myocardial depression. For the nursing care, monitoring the oxygen sats are priority. And this here is just showing decrease in tissue perfusion equals no oxygen to the organs, which results in the organs dying. Thank you.